In much of Ontario, it's been a very cold winter. And for people without adequate housing, it's been a tough and at times deadly period navigating the season and the pandemic. With us now for more in Midtown of Ontario's capital city, AJ Withers, advocate with the Shelter and Housing Justice Network and an adjunct professor of social work at York University. Welcome.
Hi.
Thank you so much for being on the show. We know this winter has been brutal. We've had record-setting temperatures. Why are people still dying from the cold in one of the richest jurisdictions in the world?
Well, the primary reason is that there isn't the political will to put in the housing and the real social policy that's needed to change things. Social assistance rates are incredibly low, and the province has a policy called Housing First, which until you've been unhoused for 6 months, you really aren't getting any kind of sufficient supports to be able to become housed, which means that people are having to undergo the brutalities of living on the streets or in the shelter systems for months before they're able to get access to something like a housing allowance. And it's really shameful, and it means that people are dying. And at the same time, this Housing First policy means that resources are being diverted from shelter systems into supportive housing that's designed for people who have been unhoused for 6 months.
6 months is a very long time. And yes, we're heading into the springtime. But for someone who is out in the cold right now, this winter must have been one of the most challenging times ever. Do we know how many unhoused people have died in the winter this past season?
No, we don't. So in Ontario, the numbers aren't tracked of how many unhoused people die or how many people die from cold. And it really comes down to we count what we think is important. And the Ontario government doesn't think that unhoused people's lives are important. In Toronto, the number of unhoused people who die is counted, but the number of deaths from cold isn't counted. It's counted as other. So we don't know how many people have died, and the number of people in Toronto is really underestimated because hospitals don't report, EMS doesn't report. So it's really difficult to track. This year, we've lost 3 people to cold and 1 to hypothermia that we know of, but that's just through the networks of frontline workers and advocates sharing what they know. That's really the best that we have in Toronto and in every community. And Toronto counts the number of people, and I'm not familiar with any other community that does.
I know this past winter, hospital workers or frontline workers were trying to raise the alarm in how many unhoused people were accessing services in hospitals. If we are not tracking these numbers, then how can we actually put money behind to solve this issue?
That's a really good question. And the tracking of the numbers isn't a new issue. The coroner was told to start tracking them in 1986 after the death of Drina Joubert, who froze to death in 1985. There was a coroner's inquest. So it's not something that's news to the coroner or the province that this is something that needs to happen. We know that we need a massive influx in both housing and the shelter system. So while we don't have the exact numbers, it's not rocket science to know that we're losing people all of the time. The Homeless Memorial has started adding double digits of people onto the Homeless Memorial monthly, and that's something that's really new and is really tragic. So we shouldn't be, as the community, left to try and calculate these things. But again, I think it is a matter of political will, of simply not even wanting to know how bad the problem is to not have to actually address it.
We know that a lot of people who are on the streets end up in Toronto because Toronto is a place that, it's very busy. Maybe people can access help easier in the city. Besides Toronto, where is the biggest community of unhoused people?
Well, that really fluctuates. I believe that it's Ottawa. So right now, it's really difficult to tell because the pandemic has resulted in the way that communities sort of track and report the number of unhoused people being very disrupted. So There's something called a streets needs assessment that is supposed to be done every couple of years, but some cities haven't done it or haven't reported the results. So we know that in Toronto, we've seen a massive increase in the number of people that are chronically homeless. And it went from 50% of the population, so that's the people that are unhoused for 6 months or more, from 50% of the population to 75% of the population, which is 1,500 people. But we don't have that data for most other cities. We have it for Windsor, also went from 50% to 75%. But because of the pandemic, cities haven't reported or haven't counted. So we're really behind in knowing how bad the situation is, aside from knowing that things are much more visible and we assume much worse in most municipalities across the province.
It's a little. I'm just trying to think that if you're in this situation where you don't have a place to live, and it seems as if the numbers are not being tracked. How does a person within that community see themselves in how other people value their existence?
So I think that most folks that I've talked to, the issue isn't whether or not you get counted once a year in what is a methodologically problematic survey. The issue is whether or not people recognize your existence on a day to day basis. So there's something called hidden homelessness, which the province and the federal government and most municipalities don't count and is often invisible. It's couch surfing, it's squatting, or trading sex for a place to stay. And that's something that we often see in rural communities much more frequently, proportionately, but is very common everywhere. And there's absolute homelessness, which is staying in the shelter system or on the street. And for both groups of people, you can exist in the world without having supports or people really acknowledging your existence. And I think that's much more important for people as human beings than necessarily being counted in a survey. And things like drop-in supports during the pandemic, libraries closed, and the social supports that people really rely on have been cut.
Well, I mentioned that this winter was extremely cold. How have shelters and warming and respite centers across the province fared during the winter months during the pandemic?
It's been really tough. So there are some cities that have opened up sort of drop-ins to make up the difference for when shelters close during the day. And there are also other places that open up emergency warming centers to deal with extreme cold weather. So Toronto, Hamilton, and London open up when it's minus 15 degrees extra space, minus 20 with the wind chill. Kingston, it has to be minus 25 for them to open up additional space. These aren't scientifically based spaces that they're opening up. The weather isn't rooted in science, the reasons that they're opening them. So the Toronto rationale, which I suspect that the other cities have copied, was simply based on the average minimum temperature of in 1995 when 3 deaths occurred. What we know is that people who are unhoused are extra susceptible to hypothermia and to frostbite, and that can occur between minus 5 and minus 10 degrees. So these spaces need to be opening up in every municipality and at much warmer temperatures than they're opening up right now. As well, things like freezing rain and snowfall also put people at real risk, and we need spaces that deal with inclement weather to open up. Windsor, it seems, has a space that they can open for inclement weather. So when there's significant snowfall or cold, I'm not sure what their exact criteria is, but every municipality needs something for inclement weather.
One of the things that we've been talking about during the pandemic is how the pandemic has exposed inequalities within our societies. Even before the pandemic, we know we have a housing crisis in this province. We've seen encampments dismantled, and we have public health measures like physical distancing. And I'm wondering how all that impacted access to shelters for people who didn't have a place to live.
So the shelter system has fewer beds in it right now than it did before the beginning of the pandemic. And it has meant that a lot of people didn't feel safe going into the shelter system and went outside instead. A lot of newly homeless people went outside. And it also means that, like, COVID with Omicron just swept through the shelter system. A lot of folks already didn't feel safe in the shelter system. There were, in Toronto, 10,000 acts of violence between 2016 and 2021. So, on top of those issues of safety, the pandemic made things a lot scarier for folks. And as you talk about inequality, 60% of Toronto's shelter population is people of color, 15% Indigenous, 13% Black. So when we're talking about the unhoused population in Toronto, which is a lot of folks that come into the city from across the province, it's disproportionately Indigenous, Black, and people of color. And a lot of folks don't feel safe in that system, go into encampments, and then find themselves criminalized, have been evicted from encampments, and just pushed further and further away from the supports that they rely on, deeper into the ravines and into the woods. Folks haven't left the encampments necessarily, they've just been forced to become less visible.
What will it take to ensure that unhoused people aren't dying in the streets anymore?
Housing. We need a massive influx of housing. The federal government can expand its rapid housing initiative that it brought in during COVID for at least 5 years and bring in significant amounts of social housing to help deal with the immediate crisis. All three levels of government need to put in housing. One of the things that Housing First has done is really focused on private market housing allowances, but there are several problems with that. One is that landlords discriminate against racialized people and against people on welfare, and that's most people who are unhoused. The other problem is that they haven't been able to use the housing allowances. So in Toronto, they had twice as many housing allowances as they were able to use last year. They were wanted to house more people than they were actually able to, because we're in a housing crisis here. We're in a housing crisis in many, many cities across the province where there just isn't enough low-income housing for people. So the government needs to implement more social housing to be able to have places for people to go that are safe and that are affordable.
It seems as if I guess I'm trying to think of how to ask this question, because if someone is watching this or listening to this, there are a lot of people in this province who are struggling to get housing. They might not be unhoused, but we are in a housing crisis. How do you make this a priority? How do you make this an immediate need to prevent more people dying on the streets?
A lot of people recognize that the housing crisis and the need for housing. And I think that we see once in a while a headline about someone dying on the streets, and once in a while that gets recognized as a tragedy, and people need to understand that what isn't a headline is about like 10, 20, 30 deaths times that single headline that people see. And for every death, there are lost fingers and toes. There are lost limbs. Every single person who is injured or dies because of the cold is someone's loved one. And these are real humans and real lives that deserve so much better, that in one of the richest places in the world, in Ontario, that we can do so much better.
AJ, thank you so much for your time. Really do appreciate your insights into this. And thank you so much for the work that you do.
Thank you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.